Hi, today we will be interviewing Elizabeth Snyder, an ER nurse. First, could you briefly introduce yourself and describe your path to becoming an ER nurse?
Okay, so my name is Elizabeth. Nursing in general is my second career. I studied psychology first.
Okay.
And after some years working in like a counseling kind of profession, I wanted to do more. I wanted to have more opportunity. I wanted to be able to get more complex in how I can help people. So I went back to school to become a nurse. I became an RN 15 years ago.
Okay.
I've worked in a mix of environments. I've done psychiatric nursing. I worked on a long-term vent unit for a while. I moved to New Jersey. I originally came from New York City. When I came here to New Jersey, I started working at Hunterdon, where I work now. I worked on there. So first it was considered the cardiac unit, and then it changed to be the intermediate care unit. I was there for a while. And then on the side, I also kept a per diem psych nursing job.
Oh, okay, nice.
Then I almost got bored. I reached this point in my career where I'm like, I've been doing this for 10 years now. I'm, just looking for some direction to go in. I'm a forward moving person. I always want to have a challenge. So I went into the float pool. I did that for a year. And while I was in the float pool, and that was during COVID times, while I was in the float pool, I really enjoyed floating to the emergency department. And something drew me there, and I decided to move to the emergency department. So that was about almost 5 years ago.
Nice.
That I moved down to the ED.
What's a float pool?
So the float pool is a nursing group in the hospital that goes everywhere. So I would get a text in the morning from the supervisor telling me what floor I was working on for the day.
Oh, okay.
And I would just show up, whether it was med surge, cardiac, any floor in the hospital except for a few of the specialty areas. So I would float to the ICU every once in a while, but because I'm not an ICU trained nurse, I would float there to assist the primary nurses, or sometimes I floated to same day surgery. But my main thing was floating to the various medical units and the emergency department. And the emergency department was always exciting. The people there were so much fun. I felt like it was just a busy, challenging environment. And then when I got there, I felt like I started my career all over again because I had to learn everything about the specialty. So I went back to that new nurse feeling. When you become a nurse for the first time, you feel really dumb, because you have to learn so much for the first time. So I got to experience that again 10 years into my career, 11 years into my career.
Wow. Were there like classes that you had to take for that, for the ER specialty?
No, I had already taken the classes. So to be able to do the level of nursing that I had been doing, I took classes I already knew ventilator care. So they wouldn't even let me take that class because I learned that on the job at my previous job.
Okay.
I had to take critical care classes. I had to take telemetry. I had to learn how to read telemetry. They made me test out of the IV class because I had already learned that on the job. A few other things. Oh, drips, learning how to do different, emergency drips or higher level drips, such as cardizem. So I had already done that when I first started at Hunterdon. So I had all that education. And then in the emergency department, I was learning on the job, learning how they do it.
Before you thought of medicine or nursing, you said you thought of counseling?
Yes.
Before that, did you consider any other fields?
Like when I was a kid, what was I thinking?
Yeah, or in high school?
Oh gosh, I've considered everything. I think all along, because when I was in middle school and I had to write an essay, I think I wrote about psychology.
Oh, okay, nice.
I've always been interested in psychology, and that currently I'm back in school to become a psychiatric nurse practitioner. So that's something I always have come back to. I don't know, just because it makes sense to me. But yeah, throughout my life, I've wanted to do, for a while, I thought I'd be a psychic on the beach, doing, living some bohemian life. That sounded attractive to me. When I was a teenager, I used to do ballet and modern dance. I thought I would be a choreographer for a while. I had a lot of different ideas. The good thing about nursing is, it's not going to afford me the chance to live on the beach necessarily, but there's always opportunities to change and grow and do different things within the field of nursing. And I like that because I have a hard time sitting still. I don't want to do the same thing the rest of my life. I want to keep learning and challenging myself.
Yeah. Is it easy to switch between specialties within nursing? Is it easier than switching specialties as a doctor?
Yes. So doctors, and I don't know too much about what it's like to be a doctor other than just casually interacting with physicians. But I've found that doctors tend to choose their specialty, do their residency in their specialty, and stick with it. And that's what I'm about to do as a nurse practitioner. I'm going to pick my specialty, and that's going to be it for the rest of my career, unless I want to go back and do another, course of education. Whereas in nursing, you get an education in general nursing. You can either go straight to a BSN program, a Bachelor of Science in Nursing, or you could do what I did. I got an associate degree. I worked for a while, and then I went back while I was working and got my bachelor's degree. And it gave me a general nursing education. And then I made my own way. So jumping from one specialty area to another was easy in the sense that all I needed was someone to give me a chance. And that's abundant in nursing, at least at this point in time. In the beginning, when you're brand new, it's a little harder to prove yourself. But once you have some experience under your belt and you've shown that you have a brain in your head, people will tend to give you chances. So you can just change and grow. It's not easy in the sense that, like I said before, every time you do something new in nursing, you have to learn it, learn brand new things and just learn the way that it works, learn the flow of that particular area.
Okay, that makes sense. So now as an ER nurse, every day will look different, but what are things that you see or deal with, or what are the things that patients come in with?
So I work in a small community hospital. So we're not one of these big hospitals that has a lot of different sections to the emergency department. In another hospital, you would have a trauma area, you would have a neuro area, and they would sort you out that way. In my hospital, I have a section of rooms and the luck of the draw who comes in. Varies by day, of course, but things that are relatively straightforward, like a simple laceration that I just need to clean the wound so that the provider can suture it. Abdominal pain, viral illnesses, things like that. Then it gets a little more complex. People come in with neurologic symptoms. We have to rule out stroke. We rarely get complex traumas. Those would go to another hospital, but there have been situations where somebody's had an accidental limb amputation, things like that, that we've had to do emergency trauma care or head injuries. But usually they don't bring us that. And then the very advanced traumas like gunshot wounds, we never get.
Okay.
At least not since I've been there.
What non-medical skills do you think are essential in your career as an ER nurse?
I think the non-medical skills are sometimes more important than the medical skills. And that's interpersonal skills, conflict resolution, in general, it's the interpersonal skills that I think are the most important. Other skills, being well organized and that sort of thing. Computer skills are important, absolutely. But I do think that you can be the smartest medical professional in the world. But if you don't really know how to talk to people from different backgrounds, different perspectives, if you don't know how to interact with somebody and not take things personally, or if you don't know how to convey a sense of empathy to somebody and make them feel heard, it's going to be difficult, at least from my perspective.
What are some important skills that you've developed throughout your nursing career so far?
Are you talking about all skills in general, or are we still talking about the non-medical stuff?
I guess non-medical stuff.
Okay. When I first started my career, I would get very overwhelmed. Everything comes at you at once. And as a new nurse, I felt like I had to know everything and be on top of everything, and I had to anticipate everything. And those skills of being able to anticipate and all of that came with time.
Okay.
So the most important thing I had to learn is how to accept everything as it came, how to not freak out when a bunch of things are happening at once, just how to not get overwhelmed in general. So now as an emergency room nurse, when 3 people come in, one of them is having a stroke, so that's immediate. All right. Time is brain. So with a stroke, you have to respond to it right away. Then the next person comes in with an allergic reaction. That's immediate. Right? Because when someone goes into anaphylaxis, their throat closes and they can't breathe.
Yeah.
And then the third person might come in a behavioral emergency. They're psychotic and they're either homicidal or suicidal. So these are 3 things that all need to be attended to at the same time.
Yeah.
And I want to freak out. But the most important skill I have is to take a deep breath, look at my resources, see who's around me to help, what I can do to somehow organize these 3 immediate emergencies at the same time. And I can't tell you right now how I do it, because you have to figure it out in the moment and figure out what you have, what resources you have, and how to do the situation with everybody staying safe.
So is there a lot of collaboration between you and the other nurses?
There has to be. One piece of advice that I would give to every new nurse is be willing to help, even when you're overwhelmed. Always be willing to help and make strong relationships with your colleagues. Stay out of conflict with your colleagues. Do the best that you can to just have a good, respectful working relationship, because you're going to need each other multiple times.
When you were talking about those 3 very severe and immediate cases, if one of those patients or like two of those patients were to get like mad at you because they think that you're not paying attention to them and focusing on another patient, how would you like deal with that kind of behavior?
I try to avoid that in the first place. I consider my initial interaction with the patient to be critical. I let them know that I see them, that they're important to me. I try and share what's on my mind. And we're talking about in a minute or 2 minute conversation. Keeping the focus on them, letting them know that I'm there and I'm actively helping them, even if they're not seeing me doing something in that moment. Okay. And that's just a quick conversation, two people connecting with each other. So I do that first. Okay. And then throughout the day, if someone's mad at me, first thing I'm going to do is listen to them. Let them not get defensive. Let them know what's going on. Do my best to try and answer that concern because they're upset, usually because they're scared. So rather than saying, hey, it's not my fault, look at what's going on, more answering that fear and saying, there's a lot that we don't know right now. Here's what we do know. Here's what's in our control. Here's what the rest of the day is going to look like. Often I'll tell someone when they first come in, even if they don't ask, I'll say, so all things considered, I'm going to estimate you'll be here around 4 hours. Not a promise, but just an estimate, kind of giving them an idea up front of what to expect. Then that way, when I come back around and they're getting antsy, I can just kind of sit with them for a minute, sometimes hold their hand and say, it's been a rough day. For you, I try not to complain about myself because they don't want to hear that. But, and say, sorry, it took me a moment to answer your call, Belle. As you can see, we're really busy, but I'm here for you. Always just reassuring them of that. Yeah,
that makes sense. Yeah. What's the most rewarding part of your job? And what's the most challenging part of your job?
There's a lot of rewarding parts of my job. On a grand scale, I have brought people back from the dead. Like, I get to bring people back from the dead. They come in dead, and I do stuff, and then they're alive again. Wow. Like, that's so cool. That's really, really cool. Or like, somebody comes in SVT, which stands for supraventricular tachycardia. All right. That means that their heart is beating so fast that it's at the point of no return. It's like, whereas you and me, our heart rate's probably around 80 or something right now. These are people, their heart rate is 200. Wow. I get to give them medication and instantly see that heart rate go down to like perfect. Wow. So that's super cool. It's also very rewarding to just meet people. I always try to take a moment to get to know my patients and find out what they did with their lives, what they do with their lives. And that's a real privilege to get to meet hundreds and hundreds of people. Challenging? I'm just exhausted. I'm really, really tired. It's tiring physically and emotionally. It's a job that takes a lot out of you. I come home and I just want to just like melt into a puddle and not talk to anybody sometimes. So that's really tough. Just all those emotional and energy ups and downs that I have to go through in a day.
Yeah. How do you like deal with really emotional and intense shifts?
I cry sometimes. I've definitely cried, and I still do. If things are overwhelming. I'll take a moment. One time I actually had a panic attack at work.
Oh.
I get a little anxious from time to time, but this one day, I had a panic attack, and I was like, "Oh, gee, I can't do this." So I allowed myself 5 minutes to have a freak out. I went into another room. I found a comfortable place. I lied down. I gave myself 5 minutes to meditate. Got over it and went back to work. You know, it's like giving yourself that time that you need to just kind of recharge and get over whatever's happening in the moment, compartmentalize that. And then if it's particularly upsetting, I'll talk to my colleagues later. You know, sometimes we'll go out and get some wings after work and just talk about what we went through during the day and how it affected us. And then sometimes when really terrible things happen, the hospital will provide a meeting where we can talk about it.
Okay, that's good.
Yeah, in some of the more really sad and upsetting situations that have happened, we'll do a debriefing.
Do you like your overall working environment with your colleagues and stuff?
Yes and no. There are days that I look around and I'm like, this place is ridiculous, because particularly ER nurses tend to have strong personalities. Most of us are pretty bold people, because you can't survive in that world being a timid person. You have to be able to, now, don't get me wrong, you can be a calm person, but you have to have a certain boldness about you to be able to do that. You can't really just fade into the background in the ED. It's not a thing, in my opinion. So when you get a lot of strong energy in the same place, it can be a lot. However, I like strong energy. I enjoy being around people with strong energy. I get like my own energy out of it. So I really do enjoy that, even though sometimes it can be stressful. It's kind of like running a marathon, you know? Not that I've ever run a marathon, but what I imagine running a marathon is like you're there in the 20-something mile and you feel like you're going to drop, but at the same time you feel great.
Yeah.
That's the kind of the way it feels to me, to be around all of these high energy people.
Yeah, it's nice. If someone's deciding between ER nursing and some other specialty, what advice would you give them to kind of like help them decide between ER nursing and some other specialty? I don't know. You just try it. Just try it. There's no shame in trying something and realizing that it's not for you, especially in the world of nursing, especially in a hospital in general, you know, because there's so many different ways that things are done. But if it looks appealing to you, if you're already a nurse and it looks appealing to you and there's an opportunity in a specialty area, try it for at least 6 months. Everything always takes at least 6 months in nursing and that's not a hard and fast rule. That's something I've decided. Like everything takes about 6 months for you to decide whether or not it's for you. Not 6 months to master it, 6 months to just not feel like you're brand new. For a young person who's getting into the medical world, who wants to know what specialty area you are interested in, a lot of hospitals have shadowing programs.
And if you contact their nursing department or HR department, depending on how it's managed in that hospital, you can come in and shadow for a while. I did that when I was in nursing school. I wanted to see what oncology looked like. And I contacted the nursing department of a specialty hospital, and they let me come in and hang out with a nurse for the day.
Nice.
Mm-hmm.
Is there any last pieces of advice that you want to give to people who are interested in becoming an ER nurse or entering emergency medicine?
Yeah. Just know that nobody does it perfectly. Nobody knows their stuff. We all learn as we're going. Nurses will be in this field for 20 or 30 years and still learning. So when you enter the profession, if you feel like you don't know anything, or you feel like the profession is bigger than you are, you enter the emergency department and things are moving so fast and you think, how can I even catch up? Just trust yourself, do one thing at a time, do the best you can, focus on what you're doing. Take moments throughout the day to reorient yourself rather than, dwelling in, oh, it's busy or it's difficult or it's challenging. More like, I'm here and I can do this, because rest assured, all of us still feel that way, even the most experienced nurses. And it's just a matter of staying focused and taking it one thing at a time.
Well, thank you for the advice, and thank you so much for the interview. It was really nice listening to what you...
Thank you. This was fun. Thanks so much.